If you ever feel out of control around food, you're not alone, and you're in the right place to learn practical, no-nonsense information about why you binge and how to stop. Binge eating does not mean that something is wrong with you. It's a natural but primitive brain response that you can correct. If you're ready for change, sign up for the Brain Over Binge self-paced online course for less than $20 per month. And if you feel you need personalized support, we also offer one-on-one coaching and group coaching. To learn more, go to brainoverbinge.com/subscribe. And I hope you enjoy the show. Welcome to the Brain Over Binge podcast, where you learn a simple, brain-based approach to ending binge eating. I'm Kathryn Hansen, your host, and I'm the author of Brain Over Binge and the Brain Over Binge Recovery Guide. My goal on this podcast is to help you stop binge eating and to keep that process as simple as possible. And to get started learning this approach, you can get my free ebook, The Brain Over Binge Basics, which is linked in the show description. And although I want to help make recovery efficient and straightforward, I understand that each of you have your own unique story. And your eating disorder developed in the midst of your own unique life. And I know that your life has so many complexities and challenges. There are likely factors in your personality or your upbringing that led you into dieting or overeating in the first place. There are reasons why your original behaviors with food ended up developing into a full-blown eating disorder. There are ways that your eating disorder became connected to your emotions or your circumstances or other aspects of your life. Also, having an eating disorder affects how you engage with your life, and it affects many of the decisions you've made along the way and the experiences that you've had. One area where this is absolutely the case is in the area of relationships. Eating disorders intersect with relationships in multifaceted ways. Relationships can sometimes be a factor in determining who begins restricting their food intake and who doesn't, or why dieting becomes out of control and leads to binging. And then the eating disorder itself can influence the type and the quality of relationships that you have, and recovery also impacts relationships. I have a wonderful guest on the show today to talk about some important aspects of this link between eating disorders and relationships. I'm honored to have Dr. Ramani Durvasula on the Brain Over Binge podcast. And for those of you who do not know Dr. Ramani, she's a clinical psychologist and author who focuses on helping people understand narcissistic relationships and heal from them. And she will tell you much more about herself in our conversation. I think that everyone needs to hear what Dr. Ramani has to say. And as we'll talk about, there are many reasons why her work can be especially applicable to people with eating disorders, and to those who have already recovered as well. Because sometimes after recovery, you take a new look at everything in your life, including your relationships, and you may want to take steps to heal other areas of your life. When you're caught up in the struggle with food, it can be easy to blame the eating disorder for any relationship struggles that you have, and to think that maybe once you're recovered, your life and your relationships will fall into place. And often that's not the case. And I want to give you resources to help you on this journey. Dr. Ramani is an amazing resource, and if you're experiencing any toxic patterns in your relationships, whether that is with parents or relatives or friends or with romantic partners, I hope that you'll listen and gain a lot of insight, hope, and help from our conversation. Dr. Ramani, welcome to the show.
Thank you so much, Kathryn, for having me. I really appreciate it.
Yeah, I'm so glad to have you here. It's such an important topic. We're going to be talking about the intersection of narcissism and narcissistic abuse with eating disorders. Mm-hmm. And you specialize in narcissism and narcissistic abuse, and I'm really happy to have you have this conversation. So before we get into that, can you just introduce yourself a little bit?
Mm-hmm. Yeah, my name is Dr. Ramani Durvasula. People know me as Dr. Ramani. I am a licensed clinical psychologist. I'm a professor emerita of psychology for 22 years. I was a researcher and teacher at California State University, Los Angeles. I do have a background in research as well. And I'm an author of now 4 books. My 4th book, It's Not You, comes out on February 20th of 2024, which we're excited about. I have a popular YouTube channel for people who are managing narcissistic relationships, a podcast, Navigating Narcissism, a healing program for people who are experiencing narcissistic abuse, and a therapist training program that I do with PESI for therapists who want to get certified in how to work with clients experiencing narcissistic abuse.
Yeah, thank you so much for that. I'm very excited about your new book
Thank
coming
you.
out. And when this episode is released, I'll have a link in the show description so you
Thank
can
you.
get that new book. So, to dive into today's topic, my listeners of this show struggle with binge eating, bulimia, binge eating disorder, and some forms of compulsive overeating, body
Mm-hmm.
image issues, restrictive dieting. And what I've found over the years is that people with these issues, it's not uncommon for them to have relationship issues as
Yeah.
well. And to
Mm-hmm.
kind of say that, hey, I'm in these kind of toxic relationships, whether that is with parents, whether that's with a significant
Mm-hmm.
other, romantic partner. And I just think there is some connection there. And I first had the idea to do this conversation with you back in May of 2021. You released a video that specifically linked eating disorders and narcissistic abuse. And I just wanted to talk about some of the things that you mentioned in that video because I thought it was so insightful and something my listeners would benefit from. So that's kind of where we're going with this. But to back up a little bit, what is narcissism?
Okay, so narcissism is a personality style. Okay, so let's stay focused on that. A lot of people get caught up on narcissism's a diagnosis. It's not a diagnosis any more than being sad is a diagnosis, right? It's a word that can describe a disorder, but narcissism is a personality style. And it's a personality style that is characterized by a person with shallow, non-genuine empathy or very little empathy, entitlement, grandiosity, arrogance, validation seeking, a superficiality, vanity, selfishness. They take advantage of other people. There's a lot of manipulative behavior in the relationship. There's often a need for power, domination, and control. These are people who at first blush can be very charming and charismatic and confident. And over time, a relationship that can often seem like it's starting from a really almost exciting and sometimes even fairy tale-ish place, but really almost an idealized place can deteriorate pretty quickly. So, but the actual personality style is characterized by those patterns and traits I described. It's on a continuum. At the mild end, people who are narcissistic are probably a bit more selfish, annoying, immature, emotionally stunted. People might even not consider their behaviors abusive as sort of not the stuff you need to keep a long-term adult relationship going. It's not good for parenting. When a person's a mild narcissist, they're too selfish. They're more concerned with the superficial aspects of their child. At the most severe end, we're talking about more of a malignant narcissistic pattern that can be coercive and exploitative and deeply manipulative and isolating. Most people who are dealing with narcissism or narcissistic people are dealing with people sort of in the middle. It's a problem. You definitely notice it. People would say over time, this is not a comfortable person to be with, but will often blame themselves in those relationships. But moderate narcissism is what most of us are dealing with. And it's definitely noticeable, but that's what narcissism is. And above all else, it's a rigid, maladaptive personality style characterized by all the stuff I just
Yeah.
shared.
Yeah. And I know it's a huge topic and I appreciate you condensing it into that description. I will include a link to your YouTube channel as well, because you do such a great job of explaining how nuanced this all is.
Yeah.
I think the term gets thrown around, oh, they're a narcissist, and it's much more complicated than that. And it takes, a while of noticing these patterns to really see that, okay, this is more of a rigid personality style. This person has a high level of narcissistic traits. So I love that about you. You're very nuanced and explain that, every person is different. Every relationship is different. So if you're listening to this, know that your relationship won't look exactly like someone else's. But if you understand these patterns, understanding has a lot of power, and you can start to see that, like the title of your new book, it's not you. It's not your fault. So thank you for all of that. And before we kind of dive into the eating disorder link, I want to mention that in that video I talked about that you did on eating disorders, you mentioned that there isn't a lot of research in this area specifically. So what you talked about in that video was more based on clinical speculation. And I want to say that that's the case for me as well. I'm saying the people I've worked with, I've noticed some relationship issues, some toxic patterns and things like that. Can you say more to that as well?
Yeah. So I'm assuming you're talking about the issue around people who have histories of either disordered eating or diagnosed eating disorders and the potential vulnerability to entering into relationships with people who have narcissistic personality styles and relationships characterized by the invalidation and the manipulation and all of that. And so there's a couple of things about this. Number one, we are not doing good research on people who are in these relationships, part of that's a measurement issue, something I'm actually trying to address. In fact, this week, having the research meeting on developing instruments that help us assess what it means to be in a narcissistic relationship. Right now, we're a bit restricted because it's not as simple emotional abuse, and it's not quite often as severe as some forms of what would be assessed in a domestic violence questionnaire, right? So we're even having trouble on that measurement piece. So that's one piece of it. We just don't study it. There's certainly research here and there about sort of relational difficulties in people who might have eating disorders and all of that, but we don't talk about it. At some level, mental health issues are always going to be a vulnerability for people in narcissistic relationships for no other reason than those issues are going to be weaponized. Again, we do know that eating disorders are also on a spectrum, and they're variegated, right? There are people with restrictive eating disorders and more anorectic patterns. There are people with more dysregulated patterns, and that would fall more under the sort of the binge purge cycles. And then there are then there's the discrimination between bulimia nervosa and binge eating disorder. Obviously, these are going to present differently and probably show up in relationships differently. But what we do know about eating disorders is that it's a preoccupation, right? And that preoccupation generalizes to a preoccupied ruminative style in other areas of the life of the person who is living with the eating disorder. So that would even mean in a relational space, there's going to be more not only of a vulnerability to rumination, but it will seem plausible when a partner is attacking that person. What's wrong with you? They might comment on appearance. They may comment on eating. They may comment on anything. We do know eating disorders have very high rates of co-occurrence with other mental health issues, that a person feels on their back foot in these relationships all the time. And a person with a narcissistic personality style, instead of being compassionate, supportive, empathic, all the things that a person with any mental health issue is going to need, it's quite the opposite. And what it keeps is this terrible dance in place where this sense of self-blame and frankly, self-doubt we see in people who are living with eating disorders gets magnified by being in the relationship with the narcissistic person. And it can feel like an almost impossible cycle to come out of. And then when we really think about how really physically debilitating disordered eating can be and eating disorders can be, that also, it's almost like there's a depletion and having to fight the fight every day in the relationship. Some people will say, I just kind of gave in. I couldn't do it anymore. But giving in that's not an answer. It actually weakens a person as well. So that's sort of, in terms of the lack of research, yes, a lot of it's anecdotal. And I think part of the problem is, Kathryn, is a lot of clinicians, when you have a client who presents with disordered eating or an eating disorder, we get so caught in the acuity of what's presented in front of us, right? We have to address the weight issues. We have to address medical safety. We have to address distortions around body image. We have to address, above all, eating habits, right? Normalizing those, or creating healthier relationships with food. That relational concerns become secondary to some degree. As the person gets better, we do give more attention to those relational concerns. But because the patient, I'm using the word patient in quotes, the patient is the focus, the person with the, if you will, quotes again, disorder, we sometimes miss the opportunity to point out how toxic the relationships are around that person. Does that make sense? It's as though the person with the eating disorder is carrying the burden of being the problem. So I think all of those are reasons that this gets missed in the clinical, the theoretical, and the empirical literature.
Yeah, I think all of that makes a lot of sense. And I teach people a lot about habit change, and you can get your eating patterns under control kind of regardless of what's going on in your life, which you alluded to. In that, in a clinical setting, yeah, we have to get the eating, make sure the person is medically safe, make sure they're eating enough, make sure their weight is restored. These things are so important that they're almost an emergency at some points. You can't wait till all your relationship patterns are solved in order to stop these very acute problematic behaviors with food. So I think that sort of ties in here as well. Like, don't wait to have a healthy relationship to have a healthy relationship with food. I think that's really an important thing to say up front here. But, as far as questions I have for you, let's back up a little bit to someone who's younger and starts dieting. That is a huge cause of eating disorders, going on a diet. What happens when you diet is you put your body and brain in the survival state. And a lot of times it does culminate in binge eating. Binge eating is really an adaptive response to food restriction in a lot of cases. So as far as narcissism, a lot of people I've talked to have a parent who is often commenting on their weight, who put them on the diet, who is always criticizing their body. So how do you see that show up as far as the parental relationship and how that could encourage someone to go down an unhealthy dieting path?
Yeah. So I'm so glad you brought that up, because a parent commenting on a child's weight is intrusive and it's a boundary violation. Okay. And it is extremely common in narcissistic parents. The narcissistic parent views the child as an extension of themselves and to satisfy their needs. And those needs may be how one looks in public, right? So they have a superficial vision of their child. A child needs to look a certain way, right? Be a certain way in the world. And so, and in the absence of empathy means they can comment on that. They can make the comments. And some would argue it could be a projection of the parent's own body image issues. Sure, but there's still a empathy problem there, right? And there's also an issue around not being able to be present with a child in the way they need to be present. But that's not the only thing that's happening with these parents. And that's one of the things they may be doing is commenting on how the child is eating at the table. You know, are they taking seconds? Their weight and shape, what they're wearing. Again, very intrusive, lots of boundary violations. And those boundary violations are very, very common even in adult narcissistic relationships. I can say whatever I want, right? With little regard for how it's affecting the person, least of all a child. But what's also happening at the same time as that is that parent is also, again, they're shaming the child's wants and needs, right? So if the child wants or needs anything that's not in line with what that parent wants or needs, they will either make the child feel guilty, like, gosh, I guess you really don't want mommy to be happy, you know, that kind of thing. So it's this sort of pushback that we've got to remember that unlike an adult, a child has no option. They have to capitulate. Right. So we often shame adults for saying, why don't you set a boundary? Why don't you do this? I'm like, oh my gosh, when did they learn this? Well, there was no learning this, right? There was a time that setting a boundary would have been a cataclysm for a person, right? So to do that in an adult close relationship feels impossible. A person might actually be able to set a boundary at work or with a friend, but in those big ticket emotional relationships, it gets hard. But for a child, it's not an option. So there's no way that child could have said something to a parent and said, please stop commenting on my body. The child will always internalize it. They will always internalize it. And it will start a very early conversation of not just, oh, I guess my body is ugly or I'm fat or whatever. It's if I don't look a certain way, I'm not going to be loved. That's a much bigger stakes. This isn't just about, I want to look like the lady on Instagram. This is, I will not be loved. I will not have attachments. That's everything. That's our nervous system, right? Well, this does get into our nervous system. And so then food almost becomes a phobic object. It becomes terrifying because the food, which is necessary, then becomes the thing that could impede attachments. If I eat this, it's, you know, then it might be if I eat this, I gain weight. It's not that simple. If I eat this, I will lose love. That's a much heavier lift. And that's what happens when you have a parent who is more narcissistic or who is at all narcissistic. It's catastrophic and it can set off an incredibly unhealthy lifelong relationship with the body. And then when you throw in there, because I have to say, Kathryn, I've worked in the area of eating disorders, and even early in my work, social media was just coming up. Now that it's full on, it's a whole different clinical issue, right? So if you have the invalidating parents who comment on weight and shape and all of that, right? And sometimes these parents play it both ways, Kathryn. Not only will they shame the child for gaining weight or not being the right shape or eating more, they may also shame the child for dressing provocatively. So the child's entire appearance becomes an absolutely fraught space. And sometimes, especially if this is not an unusual relationship between narcissistic mothers and their daughters, that the child will be criticized for weight and shape issues when they're young. Okay. Then as they get older, mom will view the daughter as competition. So now the daughter's being shamed. And so there's no winning at this. And this is something I actually don't think is often adequately discussed when we look at treatment models for disordered eating. I think a lot of the work is very cognitive behavioral, really working on the thoughts and the distortions and how you're eating. And I think that's incredibly important. But if you don't dig into the rest of it, I think there's a big part of this puzzle missing, because that mother, those parents aren't going anywhere in adulthood. And that person still has to navigate that territory.
Oh, absolutely. I think all that's super important. Like to give up binging, you have to be eating enough food. But
Right.
if you have all these deeply connected relationships with it, and you don't think you're allowed to eat because that means you won't be loved, you can see how hard it is to give up dieting and to give up restriction and therefore to give up binging. So I think all of this can be super, super helpful for people to understand where these connections have come from. I mean, just the idea that the way you eat determines whether or not you're loved. You can see how it just gets really attached in people's lives.
And something else we also see in many people who are in adult narcissistic relationships is they have a pattern we call overregulation. So, bulimia nervosa is interesting because in clients who have a more of a binge purge cycle, you do see a little more emotional dysregulation, and that's been substantiated by the research. But even when we account for that, and since so many people who have eating disorders and disordered eating actually have more of a hybrid, right? They have periods of restriction, and then they have periods of dysregulation, periods of restriction, periods of dysregulation. In fact, the people who are pure restriction, we know they have the highest rates of mortality than we see in any other mental health issue. So the issue with overregulation is an important one, because people who are in narcissistic relationships, in adulthood in particular, more often than not are overregulated. They tamp down their emotions, they tamp down their feelings, they tamp down their needs. It's a mildly dissociated state, right? Everything is numbed, everything is shut down, because the relational structures they're in, you're not allowed to say anything. You're not allowed to say you want anything, you need anything. In fact, that you even are anything. In fact, when we even go to early feminist writings about eating disorders, it was the idea of Helene Deutsch and all of them, the disappearance of woman, right? Like, I'm going to make myself disappear. And that, in a way, when you see all those themes come together at a very primal level, you see this whole theme playing out. But in a narcissistic relationship, it's beyond primal. It's like, if you have anything to say, it will be shut down. And so that overregulation also plays into this diet culture. I'm going to eat only this. I'm only going to eat that. I'm going to weigh out this. I'm going to do this. I'm going to exercise this much. And it really is, it becomes a ruminative, all absorbing cycle. And in a way, almost numbs the person off the pain from the relationship. So you can see how these cycles play off of each other.
Yeah, for sure. The next thing I want to move into is low self-esteem, because that is a huge theme in people who struggle with eating disorders. And also I know that intersects with people who are in narcissistic relationships. From what I've seen, I feel that people who do have low self-esteem and eating disorders are more vulnerable to get involved in toxic relationship patterns, whether that's narcissistic or just kind of being with the wrong person, because they feel bad about themselves. They feel like they don't deserve better. They don't know how to set boundaries. So how do you see this relationship between self-esteem, eating disorders, and narcissistic relationships?
So I think it's actually quite complicated, right? Because self-esteem is tricky. I mean, I think we probably would do better to even focus on things like, self-appraisal and self-awareness. I think that there's a lot of, elements there. But what we do know is this: it's a little bit tricky, because the existing belief that people get into narcissistic relationships because they have low self-esteem is actually inaccurate. Everyone is drawn to narcissistic people. They're charming, they're charismatic, they're confident, they tend to be attractive, they tend to be successful. That's sort of your modal representation. Even when they're malignant, and sometimes even when they're vulnerable, their sort of initial impression is a good one. So we're all attracted. When we get into the territory of things like low self-esteem, that's when people get stuck. So the getting in, I think everyone's vulnerable. The getting stuck, I think that that the narcissistic relationship can play on inner beliefs of, I don't deserve more. Or if you've had lifelong socialization that expressing your needs and wants is shameful, and a partner reinforces that, you're not even going to question it as much, right? And then there are also other elements that people who might feel like fixing things and rescuing someone and doing is what love is, because the transactional nature of a relationship, for example, with an abusive or a narcissistic parent, then sets it up that the person who gets into the narcissistic relationship kind of gets into that terrible, unbreakable vortex of, I'm going to do more, I'm going to do more. And when you do throw in there that it is not unusual in narcissistic relationships for there to be so much status on appearance that if it's the sense of, if I gain even a few pounds, I'm going to lose this person. If I look better, if I get in better shape, we hear things like revenge body. Every time I hear that, I feel sick to my stomach, because it's a sense of that this was the only way. Instead of, I'm going to go out there and actually be my full actualized self, it's no, I'm going to lose a bunch of weight. Well, of course, that's playing into their initial superficial piece, but it also means the person's forever stuck in that loop. But I do think that piece of lower self-esteem and lower self-worth and lower self-valuation, and I even take that a step further of sort of not having permission to feel as though one can express and even be in an authentic sense of self and sort of into their true self, into knowing who they are. That all is the vulnerability to get stuck in the relationship. I would argue all of us are vulnerable to getting into these relationships. It's why I do what I do, is that, you want to be so careful about that, that charm and charisma piece that we're told is so attractive, or I want to be with the person with all the money. Sure, I get the comfort of that, but you better do your homework, because if you have these vulnerabilities, and certainly a person who might be, living with an eating disorder might have these vulnerabilities, it's the getting stuck that's the problem, not the getting in.
That's a great point, because we're all susceptible. Once you're in it, like if you have lower self-esteem, it is harder to get out. And it's hard for anyone to get out. So again, it's not you. It's just that we're saying that if you have some of these characteristics, it's harder to, take that action and not to blame yourself and not to engage in people pleasing and thinking it's all your fault. And the thing is about narcissistic relationships, I understand, is a lot of times you kind of get stuck quickly in that they move fast. And a lot of times, before you know it, you're married. And then I've heard you say in a video, it can take up to about 6 months to really recognize these patterns of narcissism. So before you know it, you could kind of be stuck.
Yeah, no, they do move fast, but it may not even necessarily mean that you end up married, but there's the sort of, you end up in the mental prison a lot quicker because it was so idealized. A lot of people feel like I found my person. And the problem is, Kathryn, is that going back to, this is why I'm saying it's so subtle. We're saying that people might get stuck because they feel as though I don't deserve better. Actually, something very different happens at the front end, is that some people will say, oh my gosh, I'm being treated like a princess. It's amazing. I'm finally getting what I deserve. Is for some people, the first 1, 2, even 3 months of these relationships feel as though for the first time, the person says, oh, I'm now finally being valued. And they will actually mistake it for that very dynamic. And then the sliding down starts. And a person now says, who was I to ever think I deserved all of that? So it's a boom, boom. It's a double whammy.
Oh, that's such a great point. Yeah. I like that you brought that up. The next thing I want to move into is emotions and stress and kind of that connection with narcissistic relationships and eating disorders. Now, binge eating, what most of my listeners struggle with, can develop out of emotional eating. If someone gets involved in emotional eating patterns, overeating increases over time, there can be some brain changes, and it really changes into a binge eating habit. And I think in situations and relational situations where you do feel invalidated, where you don't feel supported, where you feel stressed, you can turn to food as sort of the emotional comfort, soothing, which then, can progress. So how do you see that connection between emotions, emotional eating, and narcissistic abuse?
So there's a lot of relationship there. One thing we know is that a person who, let's talk about someone who's already in the relationship and they may have had that as a coping tool from before. I mean, emotional eating patterns tend to get instituted even prior to adulthood, right? It becomes a go-to. It becomes, there's, whether it's eating in private, whether it's binging in private, whether it's turning to food for comfort, whatever it may be, like you said, all these precursors of a binge eating issue, is that once a person is in a narcissistic relationship, the usual doors of being able to manage emotion are all closed, right? You can't go to your partner, right? If the person also has narcissistic parent or parents, that's not a safe spot. Some people may feel a sense of shame at talking about this with friends. And the fact is, when you're having a problem at 11 o'clock at night, you're going to turn to what's available. And maladaptive coping is not unusual in people who are in narcissistic relationships. That could be alcohol use, it could be substance use, it could be excessive spending and shopping, and it sure as hell can be excessive eating. This is what, especially if it is a standard go-to, and it gets very, very complicated because, again, in so many narcissistic relationships, appearance is a focus. And so we know this when people with binge eating disorder will carry extra weight because they're having periods of time when they eat a lot of food. Emotional eating can contribute to carrying extra weight on a frame because of all of that. That's going to shift a person's appearance. So now the narcissistic partner is saying, you've gained weight, or might make horrific comments on somebody's appearance, which is already painful and hurtful, right? But then what happens is now the person has another place they're blaming themselves. Well, maybe things aren't going well because I've gained weight, without seeing that, without any other ways to cope with emotion that are safe, that they're turning to a tried and true kind of way that they've coped with it. Whatever maladaptive coping that they bring into a narcissistic relationship is really going to get magnified. It really is, because there's often nowhere else to turn. And many people won't think about therapy as an option until a ways down the road. And a lot of therapists don't pick up on the narcissistic abuse. It's what I call this pathologizing of the eater, right? Or the not eater, as it were. That's where the onus is put. And I think, and this is a real risk in the area of eating disorders therapeutic work, is everything is on that, and not enough of it is on what else could be happening around this person, because there's such a reluctance in the field of mental health to say, okay, those patterns in your relationship aren't okay, unless they elevate to the level of full-on intimate partner violence. Things like manipulation and stuff, they're considered to be within normal limits. They're not within normal limits. And the questions we should be asking is, do you feel safe voicing your needs to a partner? Do you feel safe sharing your emotions with this person? I don't think a lot of people get asked that question, but that has been sort of squeezed out of the relationship so long ago, or the person blames themselves. So that's how that cycle of using food to cope will get much worse. And because there's so much shame in these relationships, shame about being in the relationship, shame about how a person's treated in the relationship, the binging in private in a way that feels shameful is also more likely to be magnified.
Yeah, that all makes a lot of sense. There's a lot of connections that can develop there. And I think what you hit on, you have to deal with both, right? You need to stop the eating, stop the harmful eating behaviors, because those are very unhealthy, and that's not what you want to be doing regardless of, the relationship. But then you also need to look at the relationship and figure out how to heal. And I know you offer, such great resources as far as that goes, and seeing the intersection between the two, I just think can lead to a greater understanding. And with understanding, I think there comes power to really start to help yourself.
Absolutely. And it's a hard power to access, though, because I think this is why this issue, I'm so glad you brought it up, for people who are living with eating disorders and disordered eating, is this, there's such a block on it because everything's viewed through the pathology of self. It's me, it's the eating, it's the binging, it's the thising, it's the thating, it's my weight. And there's no sense of what are the other drivers of this around. We know that all disordered eating and eating disordered patterns are multi-determined, like all mental health issues. But this path is bigger than we think. And it could very well be, and this is what's tough, is we know that eating disorder treatment, there's a lot of relapse. People might even go through residential or intensive outpatient. They might get stabilized and they'll get kicked back. And I'm saying they'll go back to dieting, they'll go back to binging, they'll go back to secretive stuff, all the stuff that we see. And that cycle is, and you know this better than I do working in this area, this happens over and over again. A real predictor of relapse is being in one of these relationships.
I have a question more generally about the culture as a whole. You mentioned social media. You mentioned how that's kind of perpetuating narcissism on a cultural level, and how that can then lead people to think they have the perfect body and then try to over control their food. And that can lead down a harmful path of eating disorders. So, what do we do about this? What do we do about the prevalence of narcissistic qualities on social media and how everyone's just looking for that validation?
Yeah, we're never going to change it there. I mean, it's almost like you got to figure out the correct target, and it ain't going to be social media, right? I think that there's not a day that there's not hundreds, if not millions and millions of posts on some new, really unhealthy, if you only eat this and if you only do this, and I lost 90 pounds only eating pasta. And I'm like, oh my gosh, how's anyone ever going to navigate this territory now? And then all the, adulteration of image, everyone editing images and all of that. It's also treacherous that I know we can't fix it from the social media front. It has to be fixed from the consumption front. So once upon a time, the cigarette boxes didn't have labels. People just smoked away. People smoked when they're pregnant. They smoked in hospitals. They smoked on airplanes. I'm old enough to remember all of that. And then one day a label got thrown on. Our labels are nothing compared to the labels in other countries, which show diseased lungs and tracheotomies and things like, you're like, oh God, right? And then we put taxes on it and all of that. In a way, you've got to find a way to target prevention at the level of that kind of education. We've got to put a label on it. And in this case, you're never going to put a label on social media. No one's going to buy that. But we've got to put the label, we've got to do this in schools. I mean, at a young age, I honestly mean it, by probably around fourth grade, we have to start teaching kids how to critically assess what's happening on social media. We have to show them what a doctored image is and what one is not. We're not doing that. We're so obsessed with them being able to spell a word, which can be spell checked now by the computer, that we're losing an opportunity because a lot of kids aren't getting this at home, or their parents are already also under the hypnosis of social media, right? The parents are being just as influenced by it. There has to be some objective space for kids to be taught to be critical consumers of what's happening there, as well as doing work on developing the authentic self. This isn't easy. I mean, this would be an entire revision of how American education is constructed. We'd have to teach people to parent differently. That's never going to happen. Mm-hmm. That would be a full treatment of narcissistic styles in society. It's just not going to happen. And so there are always going to be people who are more vulnerable to the imagery. That's what some of the research on social media is showing, is that not all pubescent and adolescent youth are affected the same way. There are some kids that are more vulnerable. Everyone is affected badly. Everyone's affected badly, but there's some that are more affected badly than others. And so there are kids that are more vulnerable. We need even far more intense outreach there. But it's we're never going to also shift body image. We're never going to make the fashion industry feature anyone but a size -2 on a runway who's 17 years old selling clothes for a 50-year-old woman. We're never going to shift out of those mindsets. That's what those industries do. But right now, when human beings have become brands, it's a very, very tough shift. It's a very precarious time in human mental health. I really do think that. And I think this is going to require grassroots stuff, working with especially girls. But listen, we have seen a steep uptick in rates of eating disorders in young men. Mm-hmm. Really steep. I mean, it's actually quite astonishing. And it's a different focus. I've got to be whatever that is, shredded or cut or ripped or whatever language they use. But some of that comes from thinness. Yeah. So this culture is getting in with everyone. And we're seeing turnarounds in communities of color that were once protected. We're seeing shifts there. We see it in LGBTQ youth. I mean, it's showing up in everybody. And so this is a bigger conversation on capitalism. And since I know from my little office here, I am not going to dismantle capitalism. We are only going to be able to stick with the conversations. But it's hard because by the time a client crosses your threshold or mine, a lot of the damage has been done in terms of the indoctrination and the socialization. And there's not a day that goes by, especially on these issues around body image. I feel like a cult deprogrammer. Like I'm trying to really deprogram people from such heavily held, distorted messaging around weight and shape and appearance. And I mean, if I had $1 for every client who said to me, once I lose 50 pounds, I'm sure I'm going to fall in love. What? That would imply they themselves as a human being would change by losing weight. I'm like, but you're a lovely person at any weight. And you know what happens when they lose 50 pounds? Love doesn't show up. And so it becomes this sort of really problematic cycle. So I'm going to be honest with you, from a prevention standpoint, where social media is concerned, I don't know what we're going to do. I really, really don't. I think the genie's out of the bottle and has spawned about 1 billion other genies. So we're in trouble.
Yeah. Yeah. And I think, unfortunately, you said some people are more susceptible than others. I think the people who are more susceptible to the social media messages also tend to have those qualities of perfectionism and high anxiety, which then make people more susceptible to having issues with food.
Absolutely. Yeah.
So it is very complex. And now with AI people online and they're not even real. How can you possibly, if you can't even live up to standards of people being filtered, how can you live up to standards of fake people? Like, it's all such a mess. But I really appreciate you weighing in. I felt like that was really insightful, and I know it will be useful to people who are listening. Do you have any final thoughts before we close today?
Yeah, I do want to say a little bit about perfectionism because I'm glad you brought that up. It is, what do they say? Perfect is the enemy of good. And nowhere does that apply more honestly than in the issue of eating disorders, because perfectionism also becomes a form of regulation, right? You set an unrealistic goal and you're forever pursuing it. And that can then detach and dissociate someone from their actual emotions and feelings and their authentic self. But there's a parallel process that happens in narcissistic relationships around perfectionism, because the narcissistic people believe in perfection too. And their entire lives are devoted to, I'm going to have the perfect body, I'm going to have the perfect life, I'm going to have the perfect girlfriend, the perfect house, perfect car, perfect, right? So once you get into a narcissistic relationship, if you get close enough, you're going to get sucked into the energy field of perfectionism around them. So the pre-existing perfectionism that I think is absolutely right, part of the portrait of every person who's living with an eating disorder, now gets pulled into the perfectionism vortex of the narcissistic person. And that person may have also been raised by a narcissistic parent who has that same sense of perfectionism, right? And unfortunately, going back to, and this puts a bow on it, your social media point, where social media actually makes it seem like perfection is possible, right? Because we see this tiny slice of a person's life, a image they spent 7 hours editing, and a background that's not even real. And we're to think that this is their life, that this issue of perfectionism, it becomes a defense, it becomes a tool of regulation, it becomes the narcissist ground game. There's a lot happening there. It's in a big part of the eating disorder landscape. So to the degree we can also address that perfectionism piece. In fact, one of the things I talk about, and It's Not You, and I've traditionally talked about in this space, is tolerate average. Like, so the laundry's washed and it's not folded, you can put the clothes away. It's little tiny things. Leave the dishes in the sink. Nothing bad's going to happen. And so it's that tolerance of ambiguity, of things not being perfect, but that can bring up a lot of anxiety for people. And it's to understand what primal stuff is coming up. Because again, when we understand perfection as a tool of regulation, it can help us unpack it a bit more. But it's a big theme in these relationships.
Yeah, for sure. And it's a big theme in people with eating disorders too. So thank you for bringing that up. Where can people learn more about you, Dr. Ramani?
Yes. Well, please pre-order the book, It's Not You. It really represents a culmination of everything I've been talking about. You can find me on YouTube at Dr. Ramani, and there you'll find a massive library of videos on so many different topics, including the one from May of 2021 that you reference. We have a healing program. You can go to my website, drramani.com, spell out DOCTOR, Ramani.com. And if you go there, you'll learn about my healing program. If indeed you are in a narcissistic relationship, we have a monthly healing program with a wonderful community of people who are all grappling with these issues. And if you're a therapist interested in these issues, we have a training program that's developing around that. So there's lots of different ways that, to intersect with my stuff. I have other books as well. Again, my website's sort of the clearinghouse. You can also follow me on all social media at Dr. Ramani.
Yeah, and I strongly encourage you to do that. Dr. Ramani, I've been following you for years, and I'm so glad that you came on the show.
Thank you so much for having me.
Thank you. I appreciate you listening today, and I hope that you gain valuable information and guidance from Dr. Ramani. And I also hope you'll get her new book, which again is linked in the show description, along with her other resources. And if you need more help ending binge eating, you can always find the Brain Over Binge resources in the description as well, including my books, online course, one-on-one coaching, and group coaching. No matter where you are on your path to recovery or in your relationships, I want to encourage you and remind you that you have the power to change your brain and live a binge-free life. The Brain Over Binge podcast is produced and recorded by Brain Over Binge Recovery Coaching, LLC. All work is copyrighted by Brain Over Binge Recovery Coaching, LLC, and all rights are reserved. As a disclaimer, the hosts of the Brain Over Binge podcast are not professional counselors or licensed healthcare providers, and this podcast is not a substitute for medical advice or any form of professional therapy. Eating disorders can have serious health consequences, and you are strongly advised to seek medical attention for matters relating to your health. Please get help when you need it, and good luck on your journey. Need more help? You can find all of our current and upcoming options for support at brainoverbinge.com.